An ankle avulsion fracture occurs when a small piece of bone is pulled off by a ligament or tendon attached to it. This typically happens in the ankle due to a sudden forceful movement, such as twisting, rolling, or an impact injury. It is a type of injury that often occurs during sports or activities involving rapid changes in direction. Causes: 1. Trauma, a strong twisting or rolling of the ankle. 2. Overstretching of ligaments. Excessive tension can pull a fragment of bone away. 3. High-impact sports. Activities like basketball, soccer, or gymnastics increase the risk. 4. Falls. Landing awkwardly after a jump. Symptoms: sudden, sharp pain in the ankle. Swelling and bruising around the affected area. Difficulty bearing weight on the injured ankle. Tenderness at the site of the fracture. In some cases, a visible deformity. Diagnosis: 1. Physical examination. A doctor assesses swelling, pain, and range of motion. 2. Imaging tests. X-rays, to confirm the fracture and its severity. MRI or CT scan may be needed for detailed views in complex cases. Treatment. Treatment depends on the severity of the fracture and the associated ligament damage. It can be classified as either non-surgical or surgical. Non-surgical: rest, ice, compression, elevation. Rice reduces swelling and promotes healing. Immobilization: a cast, splint, or walking boot is used to keep the ankle stable. Pain management: over-the-counter pain relievers or anti-inflammatory medications. Physical therapy: after immobilization, exercises help restore strength and mobility. Surgical: if the bone fragment is large or significantly displaced, surgery may be required to reposition and secure the fragment with screws or pins. Recovery: healing typically takes 6 to 8 weeks, but recovery time may vary based on the severity of the injury and the individual's overall health. Gradual return to physical activity is encouraged under the guidance of a healthcare professional. Prevention: wear proper footwear for activities. Warm up and stretch before exercise. Strengthen ankle muscles through targeted exercises. Avoid uneven or slippery surfaces when possible. If you suspect an ankle avulsion fracture, seek medical attention promptly to ensure proper healing and minimize the risk of complications.